Zarinsak, if I got that right?
Yeah.
Okay.
Yeah.
And Kate Demers joined us from Crown Point Family Healthcare. And you are you're a midwife, Kate, and this is the only midwife-run IUD clinic in Ontario.
Yeah, so we're the first to start doing IUDs as midwives.
Okay, and this is really significant because, Christine, lots of women are choosing IUDs, whether as a birth control method or as a method of kind of regulating your system as you get a little bit older in life. And there's a huge, huge wait list.
Absolutely. I think, feedback from patients is that the waits are 4 to 10 months, sometimes in Hamilton. And the goal of using the expanded midwifery care model to do IUD insertions is to bring that down to about 2 weeks at our clinic.
Okay. And you brought some IUDs or some examples, some props with you here.
We did.
So show us, because I had no idea exactly how they worked, and you've got a...
Right. So the IUD is an intrauterine contraceptive device that is long-term and reversible.
Okay, so there's our uterus right there.
Right, and here's the package that the IUD sort of comes in.
Okay.
And it looks overwhelming like this, but really just the small purple part at the end is the actual device that's inserted into the uterus to do its work. And it's the first-line method of contraception as recommended by the Society of Obstetricians and Gynecologists of Canada and the Canadian Pediatric Society.
And how does it work?
So it is inserted into the uterus through the cervix, and by making contact with the lining of the uterus, it reduces the lining, so an egg can't implant.
Okay.
And it changes sort of the mucus of the cervix to also act as a contraceptive in that way, and also control blood flow because the lining is thin. So it's used, like we said, for contraception, sometimes in perimenopause and menopause to control bleeding. It's reversible, so it is really now recommended as the first line choice for contraception in all age groups.
Because it always used to be the pill, right? And now so many people are concerned about hormone levels in that and what to do. So this is, but it's something that, like, you can't do it yourself. You have to come in.
Yeah, and with the wait list being so long, it can be problematic if you do get pregnant in between. So we're trying to reduce wait times and increase accessibility for people.
And then Crown Point is doing all kinds of other things for women's health care as well. Where you are, you're at Kenilworth and Dunsmuir, close Kenilworth and Maine, essentially, right? You're really, so you can go there and get an IUD without an appointment.
So you need an appointment, but you don't need the referral from your doctor.
Yes,
exactly.
So
you can self-refer, so you can give us a call and we can schedule you in. We're happy to start out with a counseling session. And so one of the midwives there will talk to you, make sure that it's the right fit for you, figure out what will work, because there are different kinds of IUDs. There's hormonal ones and then copper ones as well. And then she will schedule you to give you a prescription and schedule you for an insertion at a later date.
Right. And I mean, the Crown Point Family Health Center is meant mainly for women in that neighborhood and which presents its own unique challenges.
It does. So we do know that people in that neighborhood have decreased access to health care. So we've done a couple of things. We've looked at the IUD clinic. We also are doing menopause classes. We're doing some of those traditional things that midwives do. So for people that are there and don't have a family doctor and deliver either at MAC or St. Joe's, we've paired with the Safe Transitions unit so that we're able to go and do home visits afterwards, making sure that babies and moms aren't falling through the cracks.
Okay, great. And you've got an open house coming up on Wednesday afternoon from 4 to 6. Thanks to both of you for coming in.
Thank you.
I'll keep coming back. If you don't focus, then I'm okay with that.
This program is brought to you by Hamilton Limo, Airport, Wedding, Events, Hamilton's trusted limo service, Hamilton's preferred choice, HamiltonLimo.com.
The Nissan Rogue. When traffic's at its toughest. The semi-autonomous technology of Nissan ProPilot Assist, a combination of intelligent cruise control and steering assist, can help you conquer your commute. And now choose your own